So, what's happening at UCLan in terms of health and innovation? Well, I think it's important to understand that we are, um, as many universities call themselves, an anchor institution within the region, based in Preston, but with campuses across Lancashire, particularly in the East, Burnley, and in Cumbria as well. So, we play an important role in our presence in those regions. We have a very big health footprint in that we are one of the few universities in the north who has a full portfolio of health workforce training programs. So ranging from nursing, midwifery, physiotherapy, allied health sciences, through to medicine, dentistry, optometry, pharmacy, and more recently veterinary, which is an interesting development, particularly with the possibility of raising One Health as a future strategic journey. But where we are with that workforce inevitably brings us into very close contact with healthcare providers, acute, primary care, social care networks, social care community-based teams. We have an enormous involvement, and a heck of a lot of our traditional research has addressed very much questions raised within those environments, care pathways, drug usage, treatment protocols, policies, housing communities, etc. We've always had a research interest in that, but I think what's happening over the last, the last decade, acutely over the last 5 years, and most acutely now, is an understanding that acute trusts really can't afford to have everybody going into hospital all the time they get an ache and a pain, that there has to be more reliance upon delivery and care within a closer to home setting, a point of care, even at home or in community environments. And my understanding at the moment is that there is certainly, with the new organisation, the ICSs and ICBs are looking very strongly at how communities can be empowered to try and maintain health within the healthy community environment. For that to happen, they're going to need innovation. They're going to need communication, they're going to need diagnostics, delivery, logistics. They're going to need workforce. They're going to need hospitals to liaise a lot closer than generally they do into that primary community. At UCLan, we've looked at that in terms of our strategic direction, our investment, our people recruitment, and we're very strong now, we believe, in picking individuals whose research ideas, whose research focus is on exactly that. Not about perhaps creating new instruments for cardiac bypass. There are plenty of good companies doing that, but very much so on emboldening communities to take control, to identify how they can come together, that strength together in communities will undoubtedly help health. We have lots of projects around getting businesses to take far more notice of their employees' health, to reduce absenteeism, and that obviously has a benefit in productivity. And my role in the university as a Vice-Chancellor is to try and direct the thinking and the focus of many of the research groups in that health and social care arena, direct their energies and activities into the community arena, into the primary arena, not losing contact with the acute trusts, of course, but giving some emphasis to that primary care arena and instructing them, rewarding, if at all possible, that any innovations that they can come up with that will empower those communities to take charge of their health, to direct their health, and the ultimate benefit is to allow hospitals to focus on real serious cases. I think that's been taken up by my academics. We're attracting new academics who are looking at point of care diagnostics, so you can get diagnosed quicker and closer to home rather than having to travel lots of distances for complicated tests. We're rewarding and developing a number of innovative-led research arenas. Real world learning is our motto, and I think this is a great example of that type of investment in training. And of course, ultimately, that culture makes its way into the classroom, if you like, into the lecture theatre, into the clinical training arena. because the new generation coming through are now being taught by individuals who are speaking the language of innovation as part of the solution towards a wider health challenge. So the university recognises that there was a, if you like, not an obstacle, a gap between the medical health arena and businesses, and we found ourselves in the middle. We would be in discussions with the healthcare providers and at the same time be in discussion with businesses, but the two of them really weren't getting together. And so because of our contact with the healthcare arena through our training programs, and we have managed to bring the four trusts to varying successes at varying times together, and with them developed a number of programs where we can enable businesses to work a lot closer with them. So an example is the innovation agency-led program called Health Matters. We can describe that as an outside-in project. So companies with ideas who might look at the NHS and say, oh, what's the point, whenever it's so difficult to get in? Well, we can act as an intermediary to give them all the advice because of our knowledge of the NHS, real-world validations, cost analysis, likelihood of investment. We can give them all that advice and push them towards that NHS procurement process, which can be daunting. But what was also clear in our discussions with health and health care providers was the number of healthcare personnel who have fantastic ideas of how they could improve healthcare. And yet, because of their background, they've spent their life at university training to be healthcare providers, they hadn't really learned perhaps the tricks or the processes that are required to get into that business arena. So we created an inside-out project called Medicom, which went into the hospitals, brought the trust together, audited what sort of ideas they got from their consultants or staff, many of them are junior doctors, took those ideas, developed them, matured them, put them into a package that says, oh, that could be possibly very useful, and brought that to the business environment. And we've had a number of dozens and dozens of companies who've now come to us working across a whole spectrum of ideas from cancer through to robotics. And I really see that as part of our job as an anchor institution and contributing to this vital arena that's going to keep the health of this nation moving forward.